I grew up with a father that smoked 2 packs a day. And every morning he would send one of us, we were 3 girls, and every morning he would send one of us out to the store to get him 2 packs of cigarettes and a newspaper. So I grew up with cigarettes around me. And I was the youngest of 3 children. My eldest sister immediately started to smoke, and probably in high school. So she was around smoking. And one by one, everybody was smoking. So it seemed a very natural thing to do, was to just sit down and have a cigarette and something to drink.
So one of the issues that we always have to remember when we talk about lung cancer is tobacco. Tobacco is responsible for about 85%, if not more, of lung cancer. And this, I think, has created a lot of complex issues in our country about how we see lung cancer, how patients feel with it, and the support that we've given to treatment and research.
No matter what people said, oh, smoking's bad for you, you ought to try to quit. I'm fine. I'm fine. And until something happens to you, you really don't take it to heart. And once it happens to you, that's a whole other thing. By then you can't, it's too late.
I think, unfortunately, there's a long history of patients' shame about the issue, and perhaps some people thinking that it was deserved in some sense, or that it wasn't an innocent process. And I really think that everyone needs to move beyond that. It hasn't helped anyone, and it is a very addictive habit, tobacco use. It is important that patients be given all the support they can to quit, but at the same time, that should not get in the way of anyone's therapy.
Well, when they told me it was cancer, it just couldn't happen to me, because I had been feeling so well up until then that I did not think that it was going to do me in. I almost didn't take it seriously. I thought, well, this is just another bronchial problem. But the minute I came up here to Dr. Goldman and he started treatment, I knew I was in deep trouble. But fortunately, we've had good results.
The biggest change is that 20 years ago, a lot of patients were told, this is so poorly treated, go home and we're not going to treat you. That, I think, should completely stop. Because of our newer treatments, everyone, I think, should at least evaluate their options. But to get to the more complex and really highly technological testing that we do now, there are several levels to that. One of them is we now need to know whether a tumor is what we call a squamous cell tumor or an other tumor, most commonly adenocarcinoma. But this helps identify 2 of our most important drugs, whether they are appropriate or not appropriate.
What course of action Dr. Goldman is going to take with me from here out, I don't know. We're having good success. We're having a lot of success with my treatment. He keeps telling me it's shrinking, it's shrinking, it's shrinking. That's what you want to hear, you know, that your tumors are shrinking.
We have new chemotherapy drugs, new targeted drugs. Patients are living longer and living better. And I think if there's only one message that people hear, lung cancer treatment has changed and patients are doing better. And that is because of very active research, a greater focus on treating patients. And that includes the younger patients that are getting cancer, the older patients that are getting cancer. Because the drugs are better and better tolerated, we can treat more patients that maybe wouldn't have tolerated the previous therapies. And when patients are treated, they're able to live the life that they want to live better than they were in the past. And it's a nice position now to be able to reassure a patient it's not going to be as you think in your mind.
I think your smokers are going to remain smokers. Like me, nothing can happen to me. I'm invincible. I smoked for all these years. And the cancer's not from smoking. That's what you tell yourself. It's not from smoking, but you really don't know.
It is still important to be clear in everyone's mind how significant tobacco use is in the overall picture of this worldwide epidemic of lung cancer.
You get to be 80, you say, oh my God, I'm 80. That's unbelievable. You really don't believe it. You say, oh, this is just something they're going to treat and everything will be fine. And then all of a sudden you believe it. And you say, what can I do to assist in getting well? And the smoking is the worst. That's the worst hurdle you can have, because there's no way you can stop. Cutting down, yes, you can cut down, which I have done, but I'm still smoking.